Everyone for being here. This is the first meeting of the Kinship Care Study Committee, and I'm going to ask the members of the committee to introduce themselves very quickly. I'm Stacey Abrams. I chair the committee. I also serve as the House Minority Leader, and I'm a legislator. I'm the representative for House District 89.
And good afternoon. I'm Tom Kirby, House District 114, Loganville.
I'm Tom Event, House District 31, and chair of the House Committee, Human Relations and Aging.
Good afternoon.
Push the button. There we go.
Good afternoon. I'm Karen Bennett. I represent parts of Stone Mountain as well as parts of Gwinnett, House District 94, and I'm happy to be here and happy to see each and every one of you.
Can you press your buttons?
I did. Good afternoon. I'm Representative Dexter Sharper, House District 177. I serve the Valdosta, Georgia area.
Representative Sam Teasley, House District 37 in Marietta.
Thank you so much. This is my first time serving as chairman, so I'm getting used to the buttons. The purpose of this committee, as I think most of you know from being here, and I want to thank you all for turning out, the purpose of the committee is to really investigate what Georgia can do better to serve the kinship care community, grandparents raising grandchildren, family members, and family friends who've taken on the responsibility of children. Some of you have done so formally through DFACS and through the state system. Some of you have done so informally. But the challenge that faces everyone is that the resources that should attend those children and help you with that responsibility don't always get to you. A couple of key facts. In Georgia, we have more than 100,000 children that we know are currently in kinship care relationships. The number is estimated to go as high as 250,000. Of the children who are in informal relationships, 16% of them are currently receiving access to SNAP and TANF benefits, but 100% of them are usually eligible. And what we have is an interwoven set of agencies that I think are trying to do their best, but often don't necessarily talk to each other or don't have the right help from the state legislature to get that work done. And so the reason we're here, the reason this is a very important committee is that we want to understand how we can make it better. Whether it's DFACS or aging, whether it's Voices for Children or Project Healthy Grandparents, there are lots of organizations that are working together, and what we want to make certain is that the family members, these grandparents, these kin, that they're getting the services they need. So the goal today is going to be to hear from the agencies first, just so we understand the lay of the land so everyone has the same background. From there, we will proceed to accept testimony from other agencies and then from citizen and community members and nonprofits, just so we get a better understanding of what's going on. We will talk about this a little bit more at the end, but this is the first of 5 meetings. The goal is to go around the state because this issue looks different depending on where you sit. Metro Atlanta has one set of issues. North Georgia has a very different set of issues. There are challenges in Southwest Georgia and in Southeast Georgia, and so we're going to go to Dalton, to Albany, to Savannah, and then return here to Atlanta. But the goal overall is to make certain that by the end of the study committee, we understand what needs to be done legislatively and what can be done through regulation, because fundamentally, my personal belief is that we don't need to pass a law to fix every problem, which I know is anathema for a representative to say. But we don't need a law for every solution. Sometimes it's just about making sure we're the most efficient way to get information out and that you all have the best way to get information in. And so I appreciate everyone's attendance. We ask for your very active participation. You should have received this document, which just gives you a snapshot of what we're talking about. There's also a website that we've created. It's www.kinshipcaregA.com, www.kinshipcaregA.com. Anyone who is unable to attend one of our meetings, they have the ability to go on that website and actually leave testimony. We want to gather as much information as possible. We have lots of resources on the website, both contact information, but also background research that we've done. And we just look forward to getting any information that we can. With that said, I would like to ask our first witness to come forward, and that would be Commissioner Bobby Cagle with DFACS.
Chair, and
Yeah, can you press your mic? Let's see.
thank you very much, Madam Chair.
Push it one more time. There you go.
Thank you very much, Madam Chair, and members of the committee for inviting me today and for taking time to shed light on the issues that are important to the vulnerable children of our state. In my first year back with the division, I've been hyper-focused on reform. When I was first appointed by Governor Deal, I walked into an agency that had 40% fewer staff than it needed in order to be able to assure the safety of children by seeing them in a timely manner. And because at that time we had more than 3,500 overdue investigations into child abuse and neglect that were overdue, meaning that they were older than 45 days, I had to immediately make addressing those front door issues my top priority. While Governor Deal has been committed to bringing down the caseloads in child welfare to an acceptable number, we could not immediately bring our staffing levels where they needed to be in that crisis. So we had to tackle the issues through overtime while the governor allocated additional resources to our department. And I thank the members of this body for supporting the increases in staff that we've gotten over the last few years. We've added more than 450 positions in the last 3 years. Our staff really pulled together in this time of crisis, and today I'm proud to say that thanks to the fortitude of our staff and the commitment of Governor Deal and the General Assembly to providing adequate staffing, we have taken that 3,500 overdue investigations down to about 200. That is what I consider to be within a 5% margin that would allow for cases that are more complex to be investigated over a longer period. That is tremendous progress, but I think we have a way to go. I've set a goal of making Georgia's Division of Family and Children Services the best child welfare agency in the world. And we've laid out a plan to do that. Some of you may have heard of it. We call it the Blueprint for Change. Blueprint for Change has 3 high-level guiding principles that I believe are paramount to stabilizing our agency and making it the most effective, responsive system for vulnerable children and families in our state. These principles involve, first, a robust workforce development, meaning that we're going to be able to recruit, pay, and retain and train the best staff possible. We also are working on development of a sound practice model. How we engage families is extremely important. Our going in a confrontational way is not helpful, and so we are focused on developing a practice model that will have a much friendlier engagement, that will make more likely that families will work with us on the plans that we develop. We also are going to be engaging constituents at all levels. We, in the past, frankly, in my estimation, haven't listened to our communities the way that we ought to. And I'm committed to making sure that we do that. In that vein, we have had 4 regional meetings around the state where we're engaging for up to 4 days at a time in those regions, trying to hear from as many people as we can. We have 10 more of those scheduled, and so we'll be in every part of the state before this is finished. I want to talk to you for a moment about what it means for those relatives who step up and make sure children who come into our attention get a better shot at a good life. Above all, the Blueprint for Change means that we're here to listen today as much as you're here to have us present. At the Division of Family and Children Services, we know that when a child comes to the attention of our agency, he or she has a better chance of succeeding in life if he can remain connected to the people and the places that he knows. Today we have almost 11,000 children in foster care in the state of Georgia, and these children have seen things that no child should ever have to see or experience. These children have experienced what no child should ever have to encounter. These children should not also have to face being uprooted from all they've ever known, especially when they are in these situations through no fault of their own. This is why relative caregivers are so important to us. In difficult times, relative caregivers can offer children the best chance of maintaining a connection to their community. They offer children their best chance at stability and hope for the future. What we know today is that in the last year, more than 6,000 of the children who exited foster care were able to do so because a relative stepped up and took care of them. Today, about 1/4 of the children in foster care are living in a relative's home. Neither of these numbers even begins to touch the number of children in our state who never came to our attention because a relative stepped up to prevent that. What we also know is that caring for a relative's child isn't exactly what our kinship caregivers signed up for, and we know that they need support. Because of that, I believe our agency has a responsibility to provide them with the support that they need on this worthwhile responsibility, especially when they've come to the attention of the Division of Family and Children's Services. To make it easier for caregivers to navigate the resources available to them, last year we began establishing a statewide network of kinship navigators that will be there to help connect relative caregivers to resources that can aid them in navigating the legal complexities of child custody. These kinship navigators also connect relative caregivers with community resources and economic assistance that may be available to them. We know that without these supports, many of these children would end up coming into the care of the Division of Family and Children's Services, and when that's not necessary, we do not want that to happen. Pursuant to the principles of the Blueprint for Change, these navigators are going to listen to our relative caregivers and provide feedback to me on what we need to do to better serve this population. The work of this committee will also help inform us, and we do appreciate that. As we firm up the infrastructure for this program, we'll be asking ourselves, what can we do in our work to be sure that more children safely stay connected to their families? We'll also be asking ourselves, what can we do in our work to make sure we set relative caregivers up for success? We'll be asking these questions because we know how much it means to children in each one of these families, and because we know that a child's success is dependent upon his caregiver's success. We have a couple of information sheets on assistance available to caregivers here. I have one that is a summary of all those. I hope you all have a copy of that. It is in a chart format, and we have those copies also available to those in the audience today. I am here to answer any questions that I can. If you stump me on any questions, I promise you we'll get you the information as quickly as possible to those questions as well. Thank you very much.
Thank you so much. Are there any questions from the committee? Representative Sharper?
Okay, thank you so much for your work already. The meetings that you've already had, who are some of the stakeholders that came out and how beneficial, what was your feedback like so far?
So we have, like I said, done 4 of these. At each location, we meet with the media, we meet with legislators in that area, we meet with law enforcement, we meet with the faith community, we meet with foster parents, I meet with my own staff, and then also at every location we meet with a cross-section of the community in a town hall format that allows them to both hear about our plans, but also to give us feedback on what they think is needed in their communities.
Okay, thank you.
Representative Bennett?
Thank you. Thank you for sharing that information. I just wondered, when you spoke about the navigator system, what is your percentage of utilization at this time?
It's relatively new, so I think it's really too early to measure that. We've only had it in existence for a few months. We are really trying to get the word out, so this gives us a good opportunity today to make sure that we are spreading the word, and I'm glad to hear that this committee has a website which also can spread that word for us. These people are very eager to get out and to help the kinship caregivers, and so we're hopeful that people will utilize it, and hopefully by the end of this committee process we can give you some idea on the volume of the calls that we're receiving.
Follow up? And at this time, how are you advertising or getting the word out into the community that this service exists?
This is being advertised primarily through our county departments at this point in time, since this is focused primarily on those people who have DFACS involvement. However, I think that is not the end of where we need to go. We need to do this more broadly, especially given the statistics that the chair lady recited early on. There are a lot of people out there who need these services, and we want them to have them.
Thank you.
Thank you.
Any further questions? Well, Commissioner Cagle, thank you so much.
Thank you very much.
We'll next hear from Tom Snyder. Would you like to introduce yourself?
With the Community Section, the Division of Aging Services within the Department of Human Services. Madam Chairman, and members of the committee, I'd like to thank you for the opportunity to provide this information about the work of Kinship Care in Georgia through the Division of Aging Services. Our mission, vision, and values for the department and the division reflect strongly the core values that are associated with kinship care, particularly strengthening families and engaging families and empowering families. The technical definition of kinship care that we use comes from the American Child Welfare League, which basically is the full-time nurturing and protection of children by relatives. That can be members of the tribe, a godparent, step-parent, really any adult who has caring responsibilities. There are several, in general, primary reasons that kinship caregiving becomes necessary, and I've listed these in order for a particular reason. The most common reasons that people think of are those at the bottom, having to do with mental illness, addiction, incarceration, teenage pregnancies, and neglect and abuse. And unfortunately, this is part of the cycle and does factor into kinship care, but this also accounts for a large stigma in the community and also within the families that often prevents them from seeking help. There are, however, other reasons that the community needs to know about why caregivers step up. Those include military deployment of a parent, death of a parent, physical illness, and economic challenges. Many parents have to move out of state to find work or move out of state to go back to school to further their economic situation. In 2012, Georgia had the 6th largest population of children living with grandparents in the United States, and that number is expected to continue to grow. And more than 250,000 children live with grandparents. Of the grandparents who are responsible for their grandchildren, more than half are still in the workforce, a quarter live below the poverty level, and about 28% of those responsible for grandchildren have a disability. This becomes important because one of the trends that we're starting to see is where the children are now having to become caregivers for an elderly grandparent or relative. And this is a fairly new phenomenon that the system is just now learning to struggle with. A kinship program was created in Georgia in 2005. There was an allocation of slightly over $500,000 to create a network of support to kinship caregivers in Georgia. That funding continued for several years. However, due to the recession, that funding was discontinued in fiscal year 2010. In the Division of Aging, we work throughout the state with a network of 12 area agencies on aging. And each of those was given the option to continue kinship services using other funding sources. Several of those did that, and since that time, a couple of others have had to discontinue services due to sequestration and other funding reductions. However, we still have 6 area agencies that receive funds through the division and provide kinship care services. Those would be Atlanta Regional Commission, Legacy Link, Northeast Georgia, the Central Savannah River area, Three Rivers, and Northwest Georgia. And in addition, 2 other area agencies provide informal support to kinship caregivers, including Southwest Georgia and the River Valley area. Support services throughout the aging network vary by region, but some of the services that are provided, including case management for relative caregivers of children who have disabilities, out-of-home respite primarily through summer day camps and vouchers for summer day camps, support groups, coordination of material aid services, which are usually back-to-school events, holiday events, those kinds of things to help support families, navigation of economic assistance programs, tutoring, community events, special events, and training for caregivers. Caregivers find services through the Aging Network in several different ways. One is through the local family connections agencies. In the agencies where we have funded services, the kinship care coordinators are actively involved in the local family connections networks and receive referrals that way. We receive referrals through the phone, through the Aging and Disability Resource Connections. We get a lot of referrals from the Division of Family and Children's Services, and we work very closely with them, and I'll speak more about that shortly. Our coordinators are also actively involved in networking with local schools and with local churches. During the last fiscal year, the Aging Network in Georgia provided 52 hours of case management for families with children who have severe disabilities. over 49,000 hours of respite care. More than 1,000 caregivers received legal assistance through Atlanta's Legal Aid Senior Legal Hotline. There were more than 16,000 contacts for support groups, training, supervision of the children, tutoring, and material aid activities, and reached more than 87,000 people through publication and community outreach events designed to make the community aware of kinship caregiving issues. The Division of Aging is also part of a Grandparents Raising Grandchildren work group that was started back in 2005-2006. Members of that include Department of Public Health, Department of Behavioral Health and Developmental Disabilities, Department of Labor, Department of Education, DFACS, Division of Child Support Services, Department of Early Care and Learning, the Legal Aid Senior Legal Hotline, Georgia State University, who is also a co-partner, co-facilitator of the National Center on Grandparents Raising Grandchildren, and we've recently added a constituent advisor to our work group to help give us the real deal, if you will. Commissioner Cagle also mentioned the Navigator program, and the Division of Aging has worked very closely with them, promoting cross-referrals and coordination of services, linking our aging services coordinators in the field with the respective navigators in those districts to ensure that regardless of which path a family comes into the system, they're able to be cross-referred to the other services and increase their ability to access services. Briefly, I want to describe some of the challenges that we see moving forward. One is obviously resources. I mentioned before some of the resource challenges, and that particularly is true in the southern part of the state and in rural areas of the state. That becomes an increasing challenge. Our network has been fairly creative. The area agency in Albany worked on developing a self-supporting peer-led support group to see how that might work with fewer resources. Also, there are federal restrictions on funding that often hamper our ability to provide services. So, for example, the Older Americans Act Title IIIe defines a caregiver as a person 55 years or older. And so we have a large number of relative caregivers who are under that age, and so we have to use other fund source and find additional funds to provide services to them. The issue is also raising awareness. Commissioner Cagle mentioned that briefly, and that continues to be an ongoing issue. I think our partnership with DFACS and our other community partners will make a significant change in that. And lastly, there's a stigma about caregiving that I think is important to acknowledge. I mentioned earlier some of the reasons most people think of, and most of those are not necessarily pleasant topics to deal with. Those have an impact on the community's perception of caregiving families, but it also, I think, impacts the caregiver's desire to keep the family matters private and not want to reach out for services. So I think that's an important stigma that needs to be overcome. Thank you, and this time I'll be glad to answer any questions that you might have.
Thank you. Chairman Benton?
Thank you. Of all the people that we have down there to do skin and keeping children, what percentage of those actually become the legal guardian of that child? In other words, they go through the preparation to have that child become their own child.
I don't know that information. I'll be certainly glad to get it back to you. I don't have that information with me, but I'll certainly be glad to provide that.
Okay, all right. Thank you.
Representative Bennett?
Thank you. With the decrease in funds that you mentioned, are you seeing that your services are not able to fully meet all of the needs that are being presented to your agency?
Yes, ma'am.
Do you have
Representative Sharper?
Just quickly, for one, I would like, if it's possible, for you guys to maybe send us that same slideshow, if that's possible, to everybody, so we can, go over it even more. Also, this may be for DFACS or whoever, anybody that's familiar with this. If a person in a situation becomes legal guardian, is there a process other than actually adopting this child that takes place?
Commissioner Cagle, do you want to?
It depends on the situation. If it's a child welfare case,
Mhm.
there are a number of ways for the child to become permanently part of an adopted family. That can be done through custody granted by the police. It can also be done by permanent guardianship through the juvenile court. It can also be done by temporary guardianship in the probate court. So there are a number of ways to do that. There's also adoption if the child has been custody by the partner and the parents' rights are permanently, and the relative has the option of adopting as well.
Okay, because I think that probably would, Representative Benton, that could probably be part of the process of what we're looking for on the numbers to see exactly how many, goes through with legal guardianship.
And just for everyone's edification, we're going to collect all of the materials, and they'll be available on the website.
Cool.
Any further questions? Thank you so much. We'll now hear from Dr. Kelly. Dr. Kelly, if you'll introduce yourself as well.
Good afternoon, Chairman Abrams and members of the committee. It's my honor to be here today. I am Susan Kelly. I'm the founder and director of Project Healthy Grandparents. We are based out of Georgia State University, where we have been serving grandparents for 20 years. We've heard some of the statistics today. I won't repeat them. We do have the largest concentration in Fulton and DeKalb counties, although, of course, this phenomenon exists in every corner of this state, and the issues that the families face are different. It's been mentioned that 25% of these families live in poverty, and I know many middle-class grandparents who have taken in families, taken in grandchildren, and it poses an economics challenge to them. And so then let's think about the families that are less economically fortunate. 30% of the families we serve are age 60 or older. And it's important to note that if you're a grandparent or a grandchild in a grandparent-headed family, you are much more likely to have one or more disabilities than a traditional, so to speak, family. We've heard some of the reasons that children are in care of the grandparents. In our experience and our research with our population, abandonment is a major issue, and this often occurs when a newborn is born at the hospital. We hear from our grandmothers that I have 2 or 3 grandchildren now with me. If I get a call from the hospital and that social worker or doctor wants me to bring home one more grandchild, I can't do it. And what do you think happens when they get the call? They step up to the plate and they bring that additional child home because they can't bear the thought of the child being separated from siblings and growing up in the system. Abuse and neglect are a major problem. That is how I got into this issue because of my 30-year involvement in the field of maltreatment. Substance abuse in our population base plays a big factor, and of course that coexists with behavioral and mental health issues on the part of the birth mother or birth father. Incarceration, we've seen the dramatic increase in the number of women in our society that are incarcerated, and that has certainly led to the increased numbers of grandparents in this situation. Of course, illnesses or injury of various types, and intimate partner violence, homicide, and other forms of death and murder. So the advantages over foster care, we heard earlier how important it is to maintain family and community continuity, maintain cultural and religious continuity. The research does indicate that children placed with relatives are more likely to remain in that foster home for longer periods of time. Sibling sets are more likely to be kept together. And we know that this is a cost-effective form of care for families. Some of the issues that grandparents face, there are many of them. Certainly grief is a major factor. Think about it. If you've lost a son or daughter to the prison system, that's significant. Families are grieving over that. If you've lost a daughter or son to death or any reason, it's significant. Social isolation, we heard a little bit earlier about stigmatization. Some of these families, they know that there are other grandparents out there, but it's almost an invisible population. People aren't anxious to go to church or their house of worship and talk about their adult child that's incarcerated. Depression, the national research shows that if you're a grandparent raising grandchildren, you're more likely to suffer from depression and psychological distress. Financial issues are always a challenge. They certainly have health challenges, significant health challenges, and we'll talk about that in a minute. The grandchildren have their challenges. Certainly developmental disabilities is an issue. Many of the children that we serve have been born exposed to alcohol and drugs. And as a result, many of these children have significant developmental disabilities. And many of these can go undetected until they get into pre-K. They experience a disruption in their attachment behaviors to their birth parents. They often have emotional and behavioral issues related to abuse and neglect. Sporadic contact with the parents. I think this could be worse than no contact at all, when the child never knows when to expect to hear from a birth parent, and it might be twice a year. They may miss Christmas, other religious holidays, birthdays, and then show up unannounced. And the children also feel isolated. I know research can be boring to non-researchers. Just quickly, I want to show that a research study that we did at Georgia State shows that if you look at the behavior problems in the children who are raised by grandparents, and I want to emphasize that behavior problems in children are really the proxy for mental health challenges. And what we found is, and no surprise to anyone here, if the grandmother has a high level of stress from what she's dealing with, the child is more likely to exhibit behavior problems. If they have less supportive home environment, and I'm talking about tangible support in the home, they're more likely to have increased behavior problems. And then resources. The fewer economic resources the families have tends to lead toward an increase in child behavior problems. So our program was founded at Georgia State in 1995. Our goal is to enhance the well-being of grandparent-headed households. In parent-absent homes, we're not serving families where the teen mom is at home. We are serving families where the parent is totally out of the household. And our ultimate goal is to improve the outcomes for the children. And we can only do that by providing a supportive environment for the grandparents. Our services are free for 1 year. We like to believe we have a holistic approach. The families that we serve are predominantly lower income and African American. Those are not criteria for inclusion in the program, but the families we serve are in South Fulton and DeKalb County. To date, we've served over 2,900 individuals and over 2,000 children. The vast majority, probably 93%, are in informal kinship care. The age range is quite amazing, anywhere from 34 to 82. And usually when the grandparents are in their 70s and 80s, they're often great-grandparents who are serving in this capacity. So what do we provide for the service for the families? Every family is assigned a social worker who does home visitations. They do legal referrals. I'll talk about that in a minute. Education on parenting issues, helping navigate complex systems, accessing child care. The health issues are a major challenge in this population. So we assign each family a registered nurse who goes into the home, assesses their health. What we have found that dealing with chronic illnesses is a major challenge, and if we don't keep the grandparents healthy, they're not going to be around to take care of the children that have become too debilitated or possibly die. So we work on their hypertension. 50% of our families are hypertensive and need medication, 25% diabetic, and 90% meet the CDC criteria for obesity or overweight. And we know the health issues that go along with that. We also offer support groups, parenting classes. I was once told by a colleague that we were arrogant to offer parenting classes to people who've already raised children. And I quickly let them know, this is what the grandparents are telling us they want. What we typically hear is, I raised my kids 25 years ago. It's a different world out there. I need to know what's going on. And transportation is a major challenge for grandparents getting to services. And if this is in Atlanta a problem with transportation, we need to think of what is it like for these families in the rural areas. The issue of legal needs of the children came up, and so we do partner with Atlanta Legal Aid Society, Kilpatrick Stockton, to provide pro bono legal services to the families in the program. And you can see on the screen here, there's a variety of options that we work with the family, what's best for them, guardianship, custody. Some families do adopt. The attorneys also help them with accessing special education programs. And wills are important. A lot of people think because they don't have much in terms of assets that they don't need a will. So we work with the families that they do need a will, and particularly they need to specify where will your grandchildren go if, God forbid, something happened to you. There needs to be a plan in place. We have an early intervention component, which is critical given the number of children with developmental disabilities. We're able, through our partnership with Emory University School of Medicine, to have these developmental disabilities diagnosed early on and get the children into services. This is one of my favorite former clients. This is Mr. Ralph Johnson. Mr. Johnson was raising these 5 grandsons on his own, 82 years old. And he did an amazing job. He did as well as anyone in his position could have. You see Mr. Johnson and the grandsons all in baseball shirts. Mr. Johnson played for the so-called Negro League over the years, and of course had a great fondness for the game and instilled that love in those grandchildren. So imagine raising these 5 grandsons, no wife, no girlfriend in the household, and he was also going to Piedmont Hospital twice a week for dialysis. So I won't read these to you. They are in the handouts you have. We do have significant amount of published research indicating the effectiveness of the program in decreasing psychological distress, improving resources, social support, coping, physical health, mental health. Here is our website with one of our grandmothers and her daughter. And some of the policy issues, perhaps they should be labeled, some of the needs. Just thrilled with what the state of Georgia has done around kinship care stipends. What has been offered to these families in the last decade has certainly been significant. Of course, you know, there's never enough, but then the state doesn't have unlimited resources. The kinship care navigator programs are fabulous. These are being implemented around the country, and I'm delighted to hear that they are being implemented statewide in Georgia. They really do make a difference, and there must be a fairly cost-effective way to reach a number of families. Support groups are a cost-effective way to reach a number of individuals because the grandparents are there supporting each other, but it's a great mechanism for getting information to multiple people at one time. We know that the children need behavioral health services, and those are difficult to get. Respite care is really important. You can imagine these grandparents need a break, weekends, evenings, and then child care. At that, let me conclude, and I would be glad to entertain any questions that any of you may have.
Thank you so much, Dr. Kelly. Any questions? Representative Teasley?
Yes, on page 1 on the handout here, the more cost-effective for government than foster care under the advantages of over foster care. Could you elaborate on that a little bit? What do you mean by that, and why is it more cost-effective?
Yes. Well, when we think about the stipends that the families receive are fairly modest, and when we look at what the cost is for a child to be in foster care on a daily basis, that those numbers for the children in foster care add up, very quickly. And there is a nonprofit in Washington, D.C., Generations United, and their economists have calculated that nationwide, that grandparents and other kinship care providers save the taxpayers $6 billion annually by reducing those foster care
Makes sense.
costs.
Okay, thank you.
Other questions from the committee? Thank you so much, Dr. Kelly.
Thank you very much.
We will next hear from Cindy Simpson with Chris Kids.
Thank you for allowing me to speak. My name is Cindy Simpson. I'm the CEO of Chris Kids. But I also represent a grandparent that is over 60, raising two grandsons, 17 and 11-year-old. But I took a different road. Mine is all under legal guardianship. But as part of Chris Kids, we do kinship care. We search for the kinship, and because we work with foster care youth. But as we've begun doing this process, and we started this really wholeheartedly in January, and I definitely believe in kinship care, obviously. But part of the issue is we have a lot of services kind of pre-kinship care, almost like adoption and matching, if you look at it that way. And then we have a lot of services that are offered once we make that connection, once that child is placed there. There are services available. We need a lot more services there. But then if we look at, okay, what's the next legal step for this kinship relationship? Is it legal guardianship? Is it adoption? What are the options? And what do those options mean? So what kind of assistance am I going to get if I become the legal guardian? If I adopt, what kind of assistance do I have? And that includes health insurance, because once you're out of the foster care system, your health insurance changes. And there's, most of the time, 90% of the time, there's a gap in health insurance. So the parent or grandparent or aunt, uncle, cousin, whoever the kinship is, there could be 30 to 45 days without any health insurance for that child. That's a problem. And that sometimes is something that stops somebody from being going into kinship care. So we need a lot more support there. And once that decision's made, lots of times there isn't any support after that. So it's like, okay, we've got this child in place with their aunt, uncle, cousin. It's going well. We've been with them for 6 months. We've supported them. We've got everything in place. But we all know, as raising children, especially those adolescent years, they still need supports. You're smiling. Yeah. It's not easy. So, and I think a lot of times we drop those supports. So even when I look at a child that's been adopted and that's been finalized, there aren't necessarily supports afterwards. And that's when they need them too. So I would encourage us to look at supports entirely through the whole process, not just pre, during. We also need to add post. And we definitely need to look at the health care. That gap is not good. So they can't get primary health or behavioral health services. I do applaud Department of Family and Children's Services to really going down this kinship navigator route. And that was part of a training that they presented, and that's what really got me even more on board on looking at our foster youth and searching for kinship care, even to the point where we have 2 foster youth that are leaving the state, going to Chicago to be with their cousin. So that's important. It's definitely better for the youth and economically better.
Thank you, Ms. Simpson. Any questions from the committee?
I like the music, though.
Any questions from the committee? Representative Bennett?
I do. Thank you so much. Could you just share with me the cause for the gap in the insurance coverage, to your understanding, what creates that?
Right, and that happens a lot even because we do reunification with children in foster care going back to their family. And once you are out of the foster care system, then you're no longer covered by the CMO, Medicaid, CMO, Amerigroup, who it is right now. So there's a gap. So that parent has to reapply. And so that's not an easy process. It's not like, they switch a button and you automatically, they have to reapply for any kind of health insurance under our Medicaid system. So we've had several that we had 4 children reunite with their mother, and it took us 90 days to get their health insurance. That's a problem.
Any other questions? Certainly.
And so at this point, there is, does a transition planning occur so that that gap is minimized?
That's what we need. We need more transition planning, and we need to have kind of some dates involved. But that involves legally, is that kinship care going to be a legal guardian? Are they going to adopt? And those things make a difference.
Thank you.
Representative Sharper?
Thank you. So you would recommend, and I know we can go deep into this at another time, but you're recommending a possible 90-day grace period would be helpful.
Yes.
From the time they make the decision. Okay.
If I become the legal guardian, I would like at least a 90-day grace period to have their continued health plan that they're on while I apply to get other health insurance.
Okay.
Any other questions? Thank you so much.
Thank you.
I'm going to butcher this name because I cannot read it. Sally Buchanan. Thank you. Thank you, Ms. Buchanan.
Thank you. Good afternoon, and thank you for the invitation to come and speak before all of you. And thank you for being part of what I'm getting ready to talk about. My name is Sally Buchanan, and I am the director and founder of Creative Community Services. And Creative Community Services, among many of the things that we do, we provide therapeutic foster care, which is actually foster care to children and youth that have intensive behavioral and mental health needs. And we use the therapeutic foster care model. That's the reason I say that we're therapeutic foster care, even though Georgia doesn't officially have therapeutic or treatment foster care. I'm here today, though, on behalf of the Georgia chapter of the Foster Family-Based Treatment Association. And that association is a national association of over 500 agencies across the country that provide therapeutic foster care or treatment foster care under the model of therapeutic treatment foster care. And I got to be the chair of that Georgia chapter and also sit on the board. Kinship Care, as an FFTA member, which is the Foster Family-Based Treatment Association member, we're well aware that Kinship Care plays a crucial role in the child welfare system. 28% of almost 400,000 children across the country in foster care are actually in kinship care. It's no exaggeration to say that kin are increasingly becoming the backbone of the child welfare system. The FFTA Association knows that children living with kin experience the same trauma that children do in non-kin families. Yet often children in kinship placements don't have the access to the same supports that are available to children that we serve in traditional foster care. Because of the way that the systems are funded and the way that they are designed, living with kin both inside and outside of the foster care system typically misses out on some of the more intensive services and supports that can make a difference in their future health and well-being, including the mental health services, the specialized training, the caregiver supports, the services for the parent, and the financial assistance. We feel that providing targeted time limited interventions with children in kinship families, child welfare agencies can achieve several goals. We can have fewer disruptions. We can have reduced lengths of stay. We can have improved safety, permanency and well-being, and prevention of more costly and ineffective placements. Having all of this information led us to be fortunate enough to receive a grant in 2013 from the Annie E. Casey Foundation to learn about the barriers and the opportunities to develop kinship treatment foster care. Kinship Treatment Foster Care Initiative is designed to promote public and private partnerships to address the social, the emotional, and behavioral challenges which we refer to as treatment needs of children in kinship care. In 2014 and early 2015, 6 states were selected to receive a grant, and Georgia was one of those lucky states to receive a grant from the Annie E. Casey through the FFTA. And in this grant, it allowed the states to be part of a summit which looks at how do we provide children that are in kinship care a treatment care initiative and become part of a treatment initiative. This was DFACS, Together Georgia, which is one of the state associations, and the Georgia chapter of the Foster Family Based Treatment Association. In May, the FFTA summit was held, and DFACS and private providers and several legislators, including Representative Abrams and her staff, started planning on how to create the impetus for a public-private partnership to plan and to implement a strategy that will engage and support kin as therapeutic foster care parents. Treatment foster care or therapeutic foster care, depends on which state you're in, what you call it, is a proven model that works to achieve safety, permanency, and well-being for children that are in foster care. This model of 24/7 crisis intervention, specialized training, and high-quality mental health and physical health intervention can be easily adapted for children that are living with kin. Too often our children are referred to private agencies after multiple disruptions in kinship care or other placements. Serving children with specialized needs in kinship placements can prevent disruptions, shorten the length of stay, and prevent inappropriate placements. Private agencies can be partners in providing time-limited services, as I mentioned, and supports to kinship families at any point along the child welfare continuum. Private agencies are also accustomed to working with kin on a case-by-case basis. We don't have like a program that's set up, but we take it case by case and work with these kin as we do with our therapeutic foster parents. Private agencies' treatment and intervention model can also be adapted to work with kin. Private agencies can engage kin families in a strength-based and culturally appropriate way. We promote therapeutic foster care, treatment foster care as a critical resource for children at every point of the child welfare continuum. Children and youth with significant treatment needs who are already placed with kinship caregivers. Children and youth who are at risk of disrupting from their kinship placement due to treatment needs. Children and youth in non-kin foster care who are disrupting from their placement and can be stabilized in a kinship setting with additional supports. This may even prevent a child from stepping out of a kinship placement into a more restrictive environment such as residential care. Also, children and youth with treatment needs who are in group care can transition into kinship setting with additional supports to the family. If you, in your packet that I handed out, there is a piece of information that is labeled Treatment Foster Care Initiative Toolkit. On page 8 of that, it's on the right-hand side, and on page 8, it gives a diagram of what the public-private partnership for kinship treatment care, foster care is about. It looks at what the private agencies do under the treatment model, what the public agencies do, and then what are the benefits of a public-private partnership. And the benefits are that we increase social, emotional, and behavioral well-being of the child, we reduce the reentry into foster care, and we prevent the breakup of kinship families. decrease the cost of the system, and increase the family connections for children. As you can see, there's also statistics that I won't read out, but there are just staggering statistics that talk about how kinship care really benefits the children, whether they're in a group care setting or whether they have aged out, and how we could prevent the aging out with no supports, and also how many children need mental health services that are actually in kinship settings, and how many receive them. We're in strong support of a public and private partnership for kinship treatment foster care. So this is why we are really talking about this today. One of the things that I wanted to share with you all is that in Region 14, which is your DeKalb and Fulton area, DFACS area, we are working, and folks have been involved in kinship care for children who cannot safely live with their families. So the Kinship Treatment Initiative is about building on this progress that this region has already been doing through their kinship navigation, and to ensure that some families can benefit from specialized treatment, intervention before it's too late. Because one of the problems that happens is that if you don't have the specialized treatment in there, you don't have the same outcomes that you would like to have. And it is a real hardship, as you've heard, on kin, and can face other difficulties that, regular foster care families don't face. This initiative is not about doing it better than the public system, but adding value to what they are already doing in the kinship care arena. One of the special projects, as I mentioned, that we are talking about through our summits that we came up, we did a test. We're getting ready to do a test run and develop procedures for how other counties and therapeutic foster care agencies can do this. This is real important because what we're doing right now, there's two agencies, Creative Community Services and Hillside, have been selected from the group of private agencies and the Department of Family and Children Services to just look at how do we do kind of a test run and how do we set the procedures for how this is going to work. Because we know that we're going to have some barriers, but it's a great opportunity. So all of the state agencies, along with licensing, has looked and said that they agree that they will do this and work with us through this initiative in order to provide this. And we do realize that not all children in kinship care need specialized interventions, and that can be provided by private agencies, but some kin families will be able to actually meet the needs of their children on their own. Only some children will need the more specialized intervention to help them to thrive and succeed. Thank you, and are there any questions?
Thank you. Are there any questions for Ms. Buchanan? Well, I want to take a moment of personal privilege. If you look in your packets on page, let's see, page 20 and 21, I will show you that I couldn't see the last name very well, but I want to thank Ms. Buchanan. There have been a series of kinship care symposiums this year, and the information that we include as the notes are all takeaways from those two conversations. And I just want to thank you publicly for the work that you're doing, convening everyone and helping us, serve this community. So thank you very much.
Thank you. Appreciate it.
Kathy Floyd.
Thank you, Ms. Chairman, for the opportunity to just say a few words here. I am Kathy Floyd. I'm the Executive Director of the Georgia Council on Aging. We were created by the legislature almost 40 years ago to serve as an advisory council for the legislature, the governor, and the state departments. We also administer a coalition of over 500 organizations and advocates. And through the years and in the last 15 years, the coalition has picked issues around grandparents raising grandchildren to come to the legislature. One of the ones was to increase the stipend to have it be somewhat closer to the what foster parents receive, because the argument is that if this grandparent hadn't stepped up, then that child would go into the foster care system, and the state would end up paying that higher rate. So that is an issue that we've been involved in. You've heard some great information here, and I just wanted to add one more thing that I haven't heard come up is we do watch when the legislature looks at the structure of TANF, and I think it's sometimes we forget that in Georgia now TANF is a lot of grandparents raising grandchildren. So you have a different situation than thinking about somebody in their 20s or 30s that that is receiving benefits. You have to consider that this could be somebody 70, 80 years old getting this benefit. And so as you look at making some changes to TANF to just remember these, that population. So I appreciate, I applaud y'all for bringing focus to this issue, and we will be very interested in the proposals that you come up with.
Thank you so much. Any questions for Ms. Floyd? Thank you.
Thank you.
Mary Davis, Kinship Care. Is Ms. Davis with us?
First of all, I want to thank you for allowing me to come and speak this evening. Now, I'm going to take it from more of a personal view. You've already heard the facts. You've heard the statistics. I am personally a grandparent, my husband and I, who have raised our granddaughter, Asia. We had her from the age of 4. She's now 20. And I think sometimes it's very important, not just we consider the facts or the statistics. I think we need to look at the individuals. And so that's why I personally brought Asia's picture with me today, and then you could maybe take a closer look. Instead of we just looking at facts, I think we need to take the time to look at the person himself. Now I want everyone here just to take a few moments, and that includes the committee, just to close your eyes for a couple of seconds and bear with me. How many of you have seen the movie A Time to Kill? There was a scene in there. Well, I want you to keep your eyes closed and just imagine it was each and every one of you sitting here today, and you had to and choose to take the responsibility of raising your grandchild. With the lack of resources that we received, it is definitely not enough. The sacrifice as a grandparent that we make. Now I want you to open your eyes. And this is something that I personally wrote, and it'll give you better clarity of what we have to deal with as grandparents. So I just not stand here representing myself in Asia, but all the grandparents. And I am from Clayton County, Senior Services, grandparents raising grandchildren. The Kinship Care grandparents. Grandparents and caregivers are in need of rest and are beginning to wonder if it's just a test. Some are presently feeling so depressed, while others are overwhelmed with stress. Yes, our children have done things that were wrong, but we still need to let them know we love them as much as the day they were born. As grandparents and caregivers, we are the ones who have to remain strong. Our grandchildren want their parents to come back home. Some just wish their parents would hear their voice on the phone. As grandparents, we have to make sure our grandparents' children are shown they are always loved and they are never alone. God sent grandparents and caregivers to Kinship Care to help take away some of our hurts and fears. Kinship is a place where everyone can cheer, and you never, ever have to be ashamed of your tears. Grandparents get a little tired of carrying the heaviest load. sometimes feeling as though we are going to explode. We too sometimes needs to be considered and told there is light at the end of the road. Grandparents and caregivers make hard financial choices every day. We don't stop rallying the capital until someone hears. Our desire is to get the support of the governor and the mayors so we can receive more help and financial share. Just to name a few of the things that Kinship Care does, it offers support groups, trips, workshop referrals, tutoring, exercise, and computer classes. You can't wait to fill up the seats. They go pretty fast. You cannot ask for better staff. They all work very hard with Angie, which is our leader, to complete their tasks. Come join us at Kinship Cast. I guaranteed you too will have a blast. And I leave with you, and I pray God will touch your heart today that we will be able to receive better benefits. God bless you.
Thank you so much. Ms. Julie Finley.
Thank you, Madam Chairman, and the members of your board and people from the legislature. I'm actually really not that prepared. I actually had heard a message on the radio yesterday while driving and did a lot of research to find out where this meeting was being held today. And through layers of that, I was actually able to connect with Danetta Norris to tell me to arrive. So I did not know that I would be speaking. But I really would like to tell you a little bit about myself and my story and my experience. I am a grandmother raising a grandchild. I'm a young grandmother. The week of my 50th birthday, inherited my granddaughter who was 5 months. My 19-year-old daughter became a victim of homicide. And at the time, I was working a career job, making 6 figures for a software developer. I live in Cobb County. I took my granddaughter in with the work environment. My company was going through a merger. The first pay cut was a $50,000 pay cut. The second pay cut the next year was a $20,000 pay cut. And I had an infant and I was single. I had just built a home. I had some health concerns that pretty much were being taken care of, but my primary concern was to take care of my granddaughter. Her mother, who I actually moved to Georgia, I'm originally from Boston, Massachusetts, but I moved to Georgia from Miami after living there for several years. And I had a number of challenges with my youngest daughter. My oldest daughter actually, well, I'll talk about her in a minute, but my youngest daughter, I did have challenges with her over the years. She had mental health concerns. So I really moved here to what I thought would save her life. Under the age of 18, she met a man that she kept away from us. We did not know she met this man until she became 18. But he met her when she was probably 16 or 17. And again, everybody thinks your child is beautiful, but I think my daughter was beautiful. Very smart and intelligent, but she did suffer from some mental health concerns. And when she became 18, she informed us that she had a boyfriend that was 33. She got involved, which I did not find out until after the death of my daughter, in human trafficking. A number of churches that had met her on the street after her death kind of put together the puzzle. And from that, we have pretty much raised my daughter, my granddaughter, with help from individuals just from their heart, not financially or any means of any tangible items, just support, love, and care. And that's probably one of the best things that you can get. But what I would like to say is that when I was, during the time of raising my granddaughter and my financial struggles, going from making $100,000 to $12,000 to being unemployed, I've actually been unemployed since 2012, not being able to find an opportunity for myself, watching my retirement money go, making sure that my granddaughter has a great foundation. My oldest daughter, college graduate, did what she was supposed to do, very engaged in her profession, which is working in branding for companies and entertainment, was not in a place at the time to even consider taking my granddaughter because she never had children. She was late 20s and now she's 31. As of last month, she legally is her guardian. But I guess the most important thing that I'd like to say is during my whole involvement with DFACS, and I've heard the facts, I've heard the statistics, I understand the program, and I'm just one face of many. My experience was, it was almost like I was invisible. People would talk to me, but they thought I was resourceful, and there was no resources really pointed in my direction. I did a lot of research on my own to connect to certain programs, and then there were certain times when I would connect to a program if they did not want to help me, and I sought outside help. For example, I contacted, I think he's my city councilman, I received retribution for doing that. It was like, who are you to do these things, or who are you, who do you think you are? And the whole time I was really simply just trying to get the best of care for my granddaughter. During my time of dealing with some of the services, the DFACS, and I came across many, many great case managers. But one of the things that I saw, maybe they were overworked, overwhelmed. I would be on the phone for 2 and 3 hours, and then all of a sudden the phone would disconnect. I would call from somebody else's phone, and someone immediately would pick up at times. I would sign up for daycare, and then all of a sudden I had to sign up for Medicare, and all of a sudden I'd have to sign up for this, and I'd have to sign up for that, and I'm thinking I provided all of this information. I would call somebody, this person no longer works here, this email no longer works here, we didn't get your information. And I would like to see, for people that are following in my footsteps or currently in the situation of dealing with some of these agencies, is that there is one person appointed to the grandparent that can help them with the process, that can steer them in the directions of services, and they can provide all of that information. I spent many, many, many hours on the phone running around trying to find this, that, you know. As of now, I live in Ackworth. My oldest daughter, I did mention, that has custody of my, well, legally the guardian of my granddaughter, who is 31, lives in Eamon Park. I guess that's Midtown. For my granddaughter started preschool. In order for her to get to preschool when when my daughter's out of town, I have to get up at 5, drive into Atlanta, you know, she goes to school, I pick her up at 3, and we go back. So most of the time I will stay in the city just simply because it's like a 5-hour back and forth. But we changed her guardianship to better suit the program, not to better suit my granddaughter. We are co-parenting my granddaughter, but it's not recognized as being co-parenting. And I continue to find resources because I am a grandmother. This has been very stressful. I understand a lot of the terms, and the language that you use is not what I would use because I'm talking from my heart. But, you know, the resources really are not there for the person that's on the other side. If you're in the agency, you're talking to the same people, and maybe some of the people that are coming across, some of the social workers, they're receiving that. I never received any of that. And I asked and I sought information and programs and services on my own. I was told I was too young. I was told I made too much. Now, I don't know about you. If you're used to making $100,000 and you're told that you need to make under 29, that right there will stress you out. But, I mean, I took an $8 an hour job and drove to Buckhead every day for a year just to keep my granddaughter in daycare because she's smart, she's intelligent, she does not have any health concerns, she doesn't have any behavioral problems, she's well adjusted, and I would like to keep it that way. But I am very much aware that I am her grandmother. I am not her mother, and I'm concerned about the stress that it has taken on for me and then my financial, because I don't have retirement money any longer. I fought to keep my home. I'm getting ready to go to court to fight the HOA, but the bottom line is it's the child. And I don't know what my granddaughter is going to face when she has to deal with her future, being told of her existence, you know, who her parents were. But I'm sure she's going to say, well, you know what? That doesn't matter. I'm who I am in my life. I have a lot of people around me that love me and care for me, and I can be anything I want to be. Thank you.
Thank you so much, Ms. Finley. Any questions from the committee? Thank you again. We have exhausted the list of people who've signed up for testimony, but I know that we have a number of legislators in the room and others. Would anyone else like to be heard? Ms. Davis, you didn't sign up, but you're welcome. We didn't know we had to sign up. Okay. We'll do Representative Thomas and then Ms. Davis.
Thank you, members of the distinguished committee. One thing I was very moved by your statements and some of the other people who are actually grandparents that are actually working with our grandchildren. The reason I have interest in this is that over the last 5 years, persons in my district have come to me and told me about this issue and how something could be done about it, and all the sort of different places they have to go. It seems like there's no coordination as it relates to this particular issue, even though there are people that are worthy and doing good work. And I do want to acknowledge the work that's being done in the foster care system, but I do know that it probably would be more helpful to some of the parents if they had money, if that money could be also raised to help persons who are actually trying not to put a child in an institutional setting. So I just want to go on record being in support of a variety of services that can be given to these parents. And I just want to read out this, that I think that planning should include seeking appropriate support services such as child care, respite care, support group, physical and mental health services, educational service, legal assistance for grandparents and relatives, and also now I would like to put the word in employment. And these services will support the children while they remain in a stable family setting. I do think it's more important that we keep families intact than putting persons in institutional settings. And if we do have family members who, you know, you would say, well, it's just what people have to do if your relative or something happens to you. But in the world that we're in, even though it's what we always, specifically from a cultural perspective, we've always taken in our children when we needed them to help them. But it's just so much money it takes nowadays to raise a kid, and also the society is a different society in terms of stress and the type of demands that we as people, professionals or otherwise, have. It is important that we do figure out a way to coordinate services so that parents who are grandparents who are helping their grandchildren don't feel that they are being shunned by the system and that they're being given the runaround. So I just, as Mabel Thomas, just want to go on record in support of a more coordinated service and more services that would include the services that those grandparents need, as well as services that the kids need as well.
Thank you, Representative Thomas. Any questions? Thank you.
Okay, thank you, Bill.
Ms. Jean Davis?
Good afternoon. Thank you so very much, Honorable Stacey Abrams, for your trailblazing work. We really appreciate what you're doing for us. And I'd like to say to the committee, thank you so much for allowing us to have an opportunity to speak, and we apologize that sometimes we are not so savvy when it comes to the computer. I'm 75 years old and really wish I didn't have to even turn it on. And I'd like to just say to you, my name is Imogene Davis. I have been in the vineyards with this, what I call passion, a trusted servant doing service for nothing since 1994. and it's now the year 2015. I first started out organizing grandparent support groups in a Waffle House because I didn't realize that there was a program for grandparents. And one day I picked up a paper, and it was the Atlanta Daily, no, it wasn't the Atlanta Daily Word, but it was another newspaper in the city that said 98,000 grandparents across the state of Georgia are raising children. This was back in 1995. I called that number, and it was Project Healthy Grandparents. And they told me, it was in October, that they only service, oh, my hearing aid's going out, please excuse me. They serviced 100 people per year, and that I would be on the waiting list. But as soon as an opening came, they would call me, and they did. The next year, I got a call from them. That was a bright star in my life. As the young lady said before, I was working and doing wonderfully well, servicing 5 states as a political director for labor unions. I enjoyed that because it helped me to make a difference. And what happened is my daughter became a drug addict. That's one of the things that happens with us in this community. She became a drug addict, and through all of my prayers and pleading with the Lord that she would change her mind and come back and take care of these children, because I did not want to be a grandmama mama. I did not want that. I really wanted to be doing the things that I was doing, but the Lord had something else for me to do. And I say he has such a great sense of humor, because I'm kicking and screaming, no, 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 that's not what I want to do. So my granddaughter now is 21 years old. She's at Alabama A&M University. Called me this morning at 6 o'clock and said, get up and see Good Morning America, because we're going to be on in Good Morning America. I know you up. And I said, okay. I'm real proud of her. But the struggle that I went through, I relate to what the young lady said before me. Everything that I called to get involved with was that I was like $200 or $300 over the level, and I couldn't get any resources or services. $200, $300 over the poverty level. That didn't make sense to me. So what I thought the Lord was preparing me for was just what I say I am, a trusted servant. Now you do the math. 1994 to 2015, I've been advocating for grandchildren to be made whole like foster children. I've heard that word so much today, and every time I hear it, I'm like, oh, but we're talking about grandchildren or children being raised by kin. This was something that was very new to me. Education has been a serious problem for us. I'm thankful for the Atlanta Legal Aid, who has a program that helps grandparents when they need help with education in the school system. Sometimes it feels that you want the grandparents to float into a wall that they don't exist. But I'd like to give you a little history. There was a bill called Senate Bill 88 that was introduced to the Georgia General Assembly in 2008 or 2009. I might have those dates mixed up. And it was introduced by Senator Unterman. I'd like to say she's a trailblazer too. And in that bill, we were asking that we develop a pilot program so that grandparents who had children that qualified would receive same or similar to what foster children get. Now I have a little graph. If I have one child and I get some TANF, I get $155 a month. Do the math. That's not even $5 a day. I really sometimes get emotional about this, because if you could see our children and the progress that they make and the sacrifices that grandparents make, it shouldn't take us all of this time to keep putting this issue on the table. We need to do something, and I'm thankful that it is still on the table. Then, after that, when I was called, a woman who was out of her mind said, we got something from Commissioner B.J. Walker when she was head of the Department of Human Services. B.J. Walker gave us, grandparents, we sat around the table. That's the other thing I need us to understand, collaboration. All of the agencies that we've talked to need to understand, in order to give grandchildren what they need us at the table. Children and grandparents. And the group that I really admire is called the Casey Family Program. The Casey Family Program says that if you don't have the families involved in planning these programs and these services, it's not going to work, because you don't know what we really need. We can help you know what you need. I've been to 2 functions this week. One on Saturday that was put on by DFACS, and I went to one in Fulton County that was put on by the Juvenile Justice System. Honorable A. Stacey Abrams, at Saturday I met 4 grandparents. On Monday I met about 8. You know what I was doing? I was carrying flyers out to those places so that the people would know to come. That's what I did today, because I said, people can't tell our stories. We have to tell our own story. And Honorable Stacey Abrams tells us that all the time. You have to tell your story. We have to be at the table when you're making these plans and these programs. I like what I saw on the screen there. But guess what? We don't know how to get the word out. Because at those 2 functions that I went to this weekend, that was a waste of money. We can't afford to give the grandparents or the kinship care people the money that their grandchildren need, but we can have these grandiose programs without having getting the word out. We can get the word out. I was told Saturday that this program was not for me, it was for new grandparents. Not treated like I'm a human being. I didn't like that at all. Because I've been advocating before, excuse my hearing aid, it's just crazy. Advocating for what grandchildren need since 1994. Here it is, 2015. And I think we have some ideas. Oh, and I do have to tell you that I did finish Morris Brown College, because the other word is out is that grandparents are illiterate. They only want money for liquor and lottery tickets. That's not true. If you give me $5 a day, if I go to the store and buy a loaf of bread, how much money I got left? Not much. It ain't enough to buy no lottery ticket. I think they cost $2 a hit. So what I'm saying to you is there are some programs out here that really tell us what we need to do. And we'd like to share with you the key components of a kinship care program that comes from, and if I'd known, I would have been able to try to get you to make me some copies today so you'd have what I have. A commitment to kin, elements of a support and service system for kinship care. And I heard Mr. Casey say something today that he must have gotten out of this book too. A report from the Casey Family Programs. One element we think is critical for the study committed to embrace is to actively engage kinship families, including children, in planning and developing services and supports, evaluating outcomes, and improving the quality of programs that serve kinship families, not foster families. We are willing to be key components in developing Georgia's kinship care support and service system. And last but not least, we support kinship families that are already out there. There's Clayton County. Remember when Governor Perdue started this program in 2009, where the 12 area agencies had a kinship care coordinator, and we were told today that because of funding, it's only 6. We found that out when we was developing Grandkids Day at the Capitol, which the leader helped us put on. We found out that there were only 6 left. But when we called people in Albany, they were saying, please, we want to come to the Capitol and advocate, but we don't even have transportation money. And we're saying, okay, we're going to see if we can get some, but we couldn't. I don't get a penny. Miss Gloria don't get a penny. Loretta don't get a penny, but we are out here beating the pavement saying, this is what we need. we want you to keep the kinship care conversation on the table. And we want to be a part of how it develops. We are asking that if we are a part, that we find some money to help compensate us for what we do. There were 3 things that I remember that stood out for me when the Lord told me that I had to do this job. When I looked and saw all of the faces of the children that this would benefit, made me feel so great. And when I see trailblazers like Renee Unterman, like our leader, Stacey Abrams, like B.J. Walker, and other people who have done some things that most people wouldn't do, it gives me joy, and it also helps me to know that I have to continue this journey. Yes, sometimes I get angry because I'm frustrated. I'm frustrated because it's taken so long to get the job done. But when I asked the Lord in 1995 to help me do a support group, and you know why I wanted to do a support group? Because of my daughter's addiction, I was going to Al-Anon. How many people in here know about Al-Anon? Quite a few of us are Alcoholics Anonymous. They have a 12-step program that helps you to understand how to live a better life. I knew that if that was something that helped me, grandparents needed that same kind of support. So we have in the Atlanta area that I know of, Project Healthy Grandparents, Clayton County Kinship Care, which is a model. I mean, everybody in the country would like to see Clayton County Kinship Care. It's great. The governor gave money for that. That's a pilot program. I'm in Fulton County, and I've been advocating in Fulton County since 2005 for a kinship care program. Can you believe that? The largest county with the largest amount of grandparents and kinship. So today I'm asking you to keep the conversation on the table. Please include grandparents who have stories to tell. I haven't told you a story today. I'm just trying to give you some background information on where I come from. So when people say, do you know that mad woman, Imogene Davis? You say, yeah, I know her. She's an advocate. She's a trusted servant. So when I leave the room, people are going to say, she's got a passion. And that's what it's all about. I'm open for questions if you have some.
Are there any questions from the committee? Representative Sharper?
Just a quick comment. Thank you so much for your work. I think that today I've heard a lot of resources that are in the room, and it seems like there's some communication gaps of actually getting the information out to the people. I think one place that would be good, and we can discuss this more, but a lot of the grandparents, and especially I'm in the rural Georgia area, so a lot of people attend church on Sundays. But if we can get with some of the faith-based organizations, pastors or whoever, and, you know, as DFACS, the other kinship programs goes, until now, I really never heard of any of the kinship programs. You know, I'm 44 years old, and I've never heard of it. My mom and dad, they raised 3 grandkids on their own totally. No, you know, no kind of support like that, just their own pockets and changing their lives around. So I think, but we can get a lot of this information out to the churches. And one thing I want us to study a little closer in, to see the different things that foster care are getting that the regular kinship people are not getting, and we need to kind of, if we can, see if we can, if the foster care stuff is better, then we need to see what we need to do, because the children are not different.
That's right.
So therefore we need to do everything we can to bridge that gap and make it, you know, one thing to help everybody.
We agree, and in my research, I found out the Children Welfare League, Child Welfare League of America, says that there is some money in the Title VII program that we can access that will help us with administration costs to help implement that program where we're asking that our children be made whole. And that was the other thing that helps me to understand. When I talk about grandparents, we're really not talking about grandparents. We're talking about our children and our future. And if we don't look at it that way, we're missing the whole point.
Any other questions?
Thank you. Thank you so much.
And just to remind the committee members, there's a sheet that was given to us by Commissioner Cagle. This actually lays out the current resources that are available, and under the eligibility, it lays out who actually can access those services. And that is indeed one of the goals of this committee, to understand which resources are available and how we make sure that there's alignment. Ms. Loretta Jenkins.
Hello, everyone. I'm Loretta Jenkins. I don't have no notes or anything, but I am a grandparent raising 7 grandkids. I got my first 2 in 2000 when I was minding my business, thinking I was about to go on vacation. All my babies were grown, and here I go. God just woke me up one morning and and I was just a dream. I thought I was dreaming. I said, wake up. And I woke up and went back to sleep, and some said, wake up again. And I woke up and I looked all over the house, my heart beating fast, like somebody done broke in my house. So I thought about my 2 grandbabies. They was on my mind. So I went to Noonan looking for them. Don't know anything about drugs. Daughter was on drugs. Neighbor told me, and I actually went to an area I never had went in a day in my life. And I was showing pictures of my daughter, and I got my first 2 babies. In 2000, Mom was on the streets on drugs. I got them with no clothes. They had only a pair of short pants and socks on, and I didn't know anything about the information that I could get from people, and I just huddled them up, took them home with me, did what I could as a grandmother raising those 2. My daughter passed away in 2012, stage 4 lung cancer. I got her 3 boys after she passed away. And after she passed away, I was so hurt. My other daughter was pregnant, and she had a little girl, so got her a little girl. When she was born 3 weeks old, I went and got her. It was just like I was having a replacement for my baby that passed away. And I got her brother right behind her. Didn't think I was going to get him, but he put the icing on the cake. I got 3 with special needs. It's a big challenge with 3 with special needs. And especially the 2 that was diagnosed with autism, or however you pronounce it. It's hard to get in-home counseling with those 2. They consider them as being retarded. My baby's not retarded. They all are people. We all are people. I do have in-home counseling for one of them because he's ADHD and suffers with depression. Sometimes it's good to, I don't see the difference. Because they all is the same to me. 3 support groups I went to. I'm in Kinship care now. One of them that's autistic, they let him in there. Thank you, Jesus. They did let him in because he's not really a problem. And one of them that's ADHD and depression, he's in the Kinship care program. And they have really been a help for me with the boys. One of them is in Project Grand, special needs, and I did go to Georgia State. They was a help with me for that year, but I need more help than a year with me, because a year is not going to, with all the years some of us have been with these grandbabies, because sometimes, it's about the grandparents and the grandkids, because we go through a lot ourselves. And with me just being a single grandparent raising 7, I don't ask nobody for nothing. I just depend on God to help me with these babies. And with the support groups, I go and I listen, and I don't say nothing much. But it is a lot, that we do go through as raising these grandkids. We didn't ask for them. And sometimes when mine get to showing out, I just say, I ask God, maybe it's just meant for me to do to raise these babies. South Fulton, I go to the schools. They see me coming, they hide their face because I'm good at the IEP and the 504 plans. A lot of grandparents they don't know anything about the 504 plans and in the IEPs. I think a lot of them have to. We need a lot of people to reach out to the schools. South Fulton, they don't have no support groups over there. And I'm over there, if I see a grandparent in need of something, here I am stepping in again, you know, to try to help somebody. And they don't know what I feel like on the inside. I smile every day, but don't nobody know my story on the inside. And all I do, you know, I just pray that you keep the good work up you all are doing. And I thank God for my footwork that I do to even go out. And today I don't have my little one with me. I usually have out with me all the time. But I pray to God that my mom will just keep the baby. She's 2 today, and she said she would do it for me. And I just thank God that, you know, for the patience with me with the baby and taking her to these schools in South Fulton to tell the people about Kinship Care, that they do have a program out there that can give them some support out there. And I just want, you know, I just thank God that you guys could come to just let us come out to hear our voices, because it's deeper than you all think it is. It's really deep inside of the grandparents themselves raising these kids, especially when you have a challenge, when they have some type of special need. Because as a grandparent, I'm special needs too. So I just thank God for y'all listening to my story.
Thank you, Ms. Jenkins. Ms. Jenkins, will you answer a couple of questions? Thank you. It's okay. Representative Sharper?
Okay, you mentioned Georgia State, they allowed you to do 1 year.
Yes.
Is that the common thing they do, 1 year?
It's 1 year. It's 1 year, but you can keep going to the group, but it's 1 year. I love when that nurse was coming out to me, because I know I needed that boost, because I was putting my grandkids first, and my help, I was putting it last, because I wanted to make sure my grandkids was healthy and they had what they needed. A lot of times they ate when I didn't. I didn't mind that, because as long as it was a little bit left, I was satisfied. But when the nurses stopped coming, you know, sometimes we need that boost, you know, because 1 year, especially if you've been in my shoes with losing a child, you know, and got, you know, one daughter out of drugs and stuff, sometimes you need a little extra help there.
Okay, because my biggest thing is just trying to see is more than 1 year available type deal. But so you're shaking your head, just 1 year and that's it?
Just 1 year.
Okay.
Yeah, they did the blood pressure, make sure you go into your doctor's appointment. They were looking at our needs.
Okay.
You know, because I'm going to support groups to look at my grandbaby's needs. And I put all of my needs on the back burner, especially when my daughter got sick and passed away. I put all my needs I had on the back burner. I wasn't thinking about me. Okay. So when they was coming, it really helped me so much. And when the services stopped for me, you know, just to have somebody come in my home just to talk to me. All I need is somebody just to speak to me. Just give me a hug and say how you're doing sometime. It helped me a lot. And when they stopped coming, you know, it's just putting it back there a little bit. But because it was a process with me having all those babies like that.
Okay, thank you.
Representative Bennett?
Thank you, Madam Leader, and thank you, Ms. Jenkins, for your story. It is very compelling, and as all of the stories are, I just have one question. We spoke about, I heard someone mention that they heard about this meeting on the radio, and Ms. Davis said that she had passed out several flyers. I just wanted to ask you how you heard about the meeting today.
On Tuesday, I was at Project Grants. That's with the kids with special needs. They only have the kids there with special needs. And I've been knowing Ms. Davis for years and years. And I first started with her program. And she was asking me, was I coming out today? And I'm like, well, what are you talking about? She was telling me about it. I said, oh, of course. I get my mom to keep my baby. And, you know, I will support anything I have to support. I want to be a part of it. And that's how I heard about it, through Ms. Davis.
Thank you.
Yeah.
Any other questions? Thank you, Ms. Jenkins.
Thank you, ma'am.
We've now exhausted the list of those who've signed up to testify, and I just want to say first and foremost thank you to all of the witnesses who gave testimony, particularly to the grandparents. I know Ms. Smith is sitting there quietly, but okay.
Good evening. My name is Gloria Smith, and I'm a 65-year-old grandmother who lives in Fulton County. I had my notes all prepared to share, but like the last person said, I'm suffering with a granddaughter that has ADHD. So me and Ms. Jean had a meeting with Fulton County today, which ran over to 1 o'clock. I tried to rush home to get my prepared notes. The school calls and said, this child is acting up again, Ms. Smith, so I had to take time out to calm her down. Now, I've been on this battle for a long time as well. I think I started in 2000. I didn't realize that it was other grandparents raising their grandchildren until I heard about the program called Project Healthy Grandparent. So that got me going. I've raised and I'm raising. And when I say raised, I have a 25-year-old granddaughter that I had since she was 2. She is now 25. She got her master's from Fort Valley, and I like to say thank you to Representative Calvin Smiley because he was her mentor along the way. And she got her master's from Clayton State. She's been teaching for 2 years in Rockdale County, 10th grade last year and 9th grade this year. But I'm still raising. I have my 13-year-old Diamond, which is a special need child. So that means I spend a lot of my time at doctor's appointments, therapy appointments, school, because I've got to go to the school tomorrow. But I've been through the program, and I've been through a lot of different things, and a lot of things is not working. Years ago, it was the Kinship Care program with navigators. I was one of them navigators. I worked in DeKalb County. But the options didn't make it good for me, because for me to continue to be the navigator, I was going to lose my food stamps, and then I was going to lose my Medicaid. So when I sat down and did the math, it was not good math for me to do that at that time. But sir, I appreciate what you say, because one of my biggest concerns is that grandparents, if we got half of what foster parents had, we would be doing good. Now, Diamond, she gives me challenges. She was in the Kinship Care program. And for the last 2 years, they told me that she was excellent at swimming and tennis. But I can't figure out how to budget to keep that activity going for her, because it's going to cost to go to swimming classes and swim meets and tennis meets. So that's where the extra money comes from, is to do all of these extra things that needs to be done that's not there. Our children, we can't make differences in the children. Children are children, no matter who they be raised by. It's so many facts that states that it's better for a kid to stay with a relative than to go to foster care to a stranger. We all know that. We all know the facts. So I am excited about this work going on, and I'm hopeful that at the end of the day, we're going to come up with some concrete, positive decisions. Because like they say back in the 60s, Spike Lee, let's just do the right thing. Thank you.
Thank you, Ms. Smith. I actually have a couple of questions.
Okay.
Representative Kirby?
Thank you, Madam Chair. And you may know this, and it may be up here, but I haven't found it. I've heard several times about, and you said if we just got half what they get a foster parent. Do I have anything up here that tells me what a foster parent gets, or can you tell me how much they're getting?
You got the facts. I know it's a big difference. You have the facts.
Foster parents get $12 to $15 a day per child. A day for a child. And it's according to age. And we get $155 a month.
So do the math on that.
Yeah.
Okay. Thank you.
Any other questions? Thank you, Ms.
Thank you so much.
Well, again, I want to say thank you to everyone for being here and want to talk about next steps. We are going to be meeting, as I said at the beginning, we're going to meet a total of 5 times as a committee around the state and put together our recommendations. As a study committee, our job is to gather information, to make recommendations, and then to present that to the General Assembly, in this case, to the House of Representatives. We will look at both legislative recommendations, but also policy recommendations, because not everything has to happen through legislation. And as you've heard, there's a lot that's going on, both in the government region, in government, but also through nonprofits. And it's critical that we talk about all of those pieces, because I think, as a number of the grandparents have said, this is a holistic problem, so we need a holistic solution. I'm very privileged to serve as the chair of this committee, but even better for you guys, we have Chairman Benton, whose committee, actually, the study committee legislation went through, and who has been not only, if you don't mind me telling folks, is not only, like the Hair Club for Men, not only the chairman, but he's also a client. He has an 8-year-old who's living with him because of his son, and I think most of us up here have a personal experience with this issue, and so we take it very seriously. And I just want to say thank you for the information you've delivered. I would ask anyone who made a presentation to make sure, we'll be in touch with you, make sure you provide that presentation. We want to make sure everything is kept on the website. If you have questions, please go to the website. And if you can't go to the website, Ms. Davis knows how to find me. I think she has a tracker in my bag. But we are happy to take verbal testimony. We would love to have it written down so we can keep it for posterity, but we appreciate it. We're going to be going across the state. Our next meeting will be in Dalton, Georgia, on September 29th. We're going to be at Dalton City Hall. October 13th, we're going to be in Albany. October 27th, we'll be in Savannah, and then we're back in Atlanta on November 12th. At the 3 meetings that we're having out of Atlanta, and then again the last meeting we have back in Atlanta, we will provide childcare. So please reach out to your networks in those communities. We're trying to talk to Family Connections, to a lot of the community groups in those areas, the kinship care groups. We don't want grandparents not to come. We don't want kin not to come because they have to worry about children. So we're going to make sure that there's someone there to watch the kids. I said child care. I don't have a budget, so I've got. See this. To Dalton. What I would recommend is that if you know folks in Dalton, because as everyone knows, this is not just an issue for Metro Atlanta. One of the things you'll see on the website, there's a packet, but there's a map. And actually, I think a lot of folks are surprised to find out that the 2 densest regions for this challenge is actually not Metro Atlanta. The densest areas are North Georgia and Southwest Georgia. And we need to make sure we're going across the state, because this, as long as this is a Metro Atlanta problem, then it only gets a Metro Atlanta solution. And what I'm privileged about is having a committee, having committee members who understand how broad this issue is. The Speaker of the House has been involved in this conversation. The Governor has been incredibly responsive to questions that we've raised. And we want to make sure that we raise this issue, that going into 2016, this is the year that Ms. Davis gets to retire. And that we can put together some recommendations that really help to affect families. We have several items. I think we have some extra copies of this, so if you want to pick one up, it has a list of the locations. We're going to be at City Hall in Dalton. We'll be at the Southwest Georgia Council on Aging in Albany. We'll be at the Coastal Georgia Center in Savannah. And we have not yet set the location here in Atlanta, but we will get that information out as soon as possible. But I just want to again say thank you. I want to give a moment for any of the committee members to make any comments if they'd like to make anything.
Just briefly, the message I got clearly today is that we're trying to make the children whole as well as their kin whole. So that's going to stick with me. Just trying to make everybody whole.
I want to say thank you to the staff that has put together all of this information, and to Sean Marie, who's with us from Legislative Council. I want to remind everyone the website is kinshipcarega.com. Kinshipcarega.com. Please share that with your networks. If you use social media, please push this out. Representative Bennett asked a good question. How do people find out? We've gone to radio stations. We've sent things to the newspapers and communities. We are doing our best to make sure people know about this. This doesn't change if people aren't aware. So please use your social networks to push this information out. We want to have as much robust testimony as possible. And if all hearts and minds are clear, we are adjourned. Thank you.